Yes, so this new variant comes from it's still Omicron, so it hasn't evolved. It's not new in the sense that it's still recombinant from BA2 sublineage of Omicron itself. But why it's better than the previous XBB variant is because it's not only more transmissible, but it's also better at immune escape by attaching to ACE2 receptors better. So really it's kind of a turbocharged XBB variant with these two factors. That means it's spreading like wildfire in the United States right now. And it's almost certainly going to dominate the world. There just really isn't another variant near it in competition.
Well, as you say, it has been spreading like wildfire, doubling almost every week in the US. How long until it is the dominant subvariant there and indeed globally?
It has a R factor of 1.6, so we're looking at a pretty short timeline to getting outcompeting the other variants. However, just because it is more infectious and evades immunity doesn't mean that our tools like vaccines aren't effective. They're still going to help prevent the most severe disease and reduce hospitalization. And that's really the biggest stressors on the health systems. So while we expect a surge in cases and infections to pick back up again, particularly this time of year, and this new variant, we also know that vaccination remains an effective tool. And people right now, I think the biggest challenge is to ensure that these boosters are actually being taken up. In the UK, we have perhaps only half of our 50 and 6-year-olds who have opted to take their fourth booster. So we need to really get that messaging out about, right now we're facing another big wave, and it's important to protect yourself against serious disease.
Do we know if this particular subvariant causes more serious illness compared to others?
We don't have the data on that yet. However, again, the biggest tool to prevent that is vaccination. So while we don't know that it causes more severe disease at this stage, we do know that it is going to be the most dominant form, so it's more likely for people to catch this particular strain. But really the advice stays the same, which is if you haven't been boosted, get that booster. And if you have, if you're traveling in condensed, in very crowded areas, following the WHO advice to use that face mask to protect yourself and others. So we still need to get that evidence around severity of disease, but sometimes what we do see is an evolutionary trade-off where if there is more infectiousness, sometimes with the original Omicron, Delta had more severe symptoms associated with it. But Omicron overtook Delta, and in result, we had a milder form of disease. So the jury's still out on that one.
So overall, we are then seeing trends in terms of the danger that COVID poses to people around the world?
Well, certainly every time we have more disease circulating, and because you can also have a co-infection, you can have flu and COVID at the same time, that does place more people at risk, and particularly the more vulnerable. So if we aren't taking the appropriate precautions, of course that risk then increases.
Now, it's been 3 years since COVID emerged. How different does the virus look compared to when the pandemic first hit?
Well, we're in a much better position now than when the pandemic first hit. We have appropriate tools. We have much better understanding of the disease. We have more support in place. But one of the issues that we do face, of course, is just the wear and tear of the health systems, the burnout of health staff. Particularly in the UK, this is a big problem. And we see that nurses are now striking, as well as ambulance care workers. So that in addition to a wave of XBB.1.5 is going to be a significant challenge on the UK health system, but in other places as well. It's not just a unique problem to the UK. Many health systems have really been stretched to the limit over the past 3 years by consecutive waves of COVID. China going through some of, again, the worst of its COVID infections now, where, again, huge strain on health systems and wider supply chains as well, with medicine shortages. So overall, while we have a better understanding of the disease and we have some preventative measures available to us, we know that face masks are effective, vaccines are effective. We do have the challenges of encouraging those behaviors, B, perhaps most importantly, just the capacity of the healthcare systems themselves, and that will vary from country to country. China going through a really enormous pressure right now. It's predicted that 3 waves will come out of this current BF7 variant that is circulating there, although we'll expect to see XBB 1.5. Hard to say because the data transparency, it's a bit of a black hole when we're looking at information coming from China on COVID, but we do know that ramifications will be felt globally.